Hi, I'm Dr. Bob Carnes, and we're here today to demonstrate with you the LZR7 technology that we use here in our office to help people with allergies. We want to protect people's health, and allergies are a big factor in our world that causes a lot of inflammation in people's bodies, and that causes their immune system to be triggered. So we're going to talk to you about that and show you how we use the LZR7. This is Lauren Dare. She's a member of our wellness team, and she's gonna she administers these treatments in our office, and so she's going to demonstrate, and I'm going to be the patient. She does a free consult for people who have allergies and want to see how this technology works. But we're going to go ahead and show you what she would normally do on a free consult, and I'm going to be the patient. I'll be asking some questions along the way, as if I don't know what's going on. So we'll just have fun with it and show you what this looks like.
All right, good morning, Dr. Carnes. We're going to start, and we're going to go ahead and start an LZR7 treatment. The LZR7 works by trying to clear the inflammation in your body, so it finds the inflammation and then it desensitizes anything that causes that inflammation. So we're going to start first by putting the cuff on your arm. We're going to spray your arm with water so that we get good skin conductivity between the cuff and the sensors in the cuff and your skin.
And this isn't going to hurt, is it?
No, this is painless. So unlike an allergy prick test or anything, we're going to test for sensitivities just by searching for the frequencies, or taking frequencies, introducing that to your skin, and seeing the stress response that your skin makes.
Now, frequencies, that's kind of a big word and kind of hard to understand sometimes, but it's kind of like radio frequencies, right? I mean, when a radio station puts out a frequency of music, we dial that in with our radio, and then we're listening to the music frequencies in our ear, and so we're going to be dealing with frequencies. You can't see them, obviously, but they're out there.
Yes.
And so that's kind of what we're dealing with here, right?
Exactly. Every item vibrates at its own speed. Every item has a frequency, and those can still cause sensitivities and allergens. And so we're going to introduce those frequencies to your skin. The system will then categorize those, find the ones that inflame you, and from there we're going to desensitize that.
So like milk would have its own distinct frequency, kind of like we all have different fingerprints, right?
Yes.
Yeah, okay.
All right, so we're just going to do a quick scan. And our first thing we do is to make sure that the wrist cuff is getting the right reading from your skin.
So this is kind of like a lie detector test, right? You know, when they put that on, they're measuring physiological change, like rapid heartbeat or higher blood pressure if somebody's telling the truth or they're not, right?
Exactly. It works exactly the same way. And so when we start the scan, you can see that we have 8 sensors in the cuffs. This is like 8 muscle tests in one. Your dotted line is showing no response or no reaction, and all these other ones are showing some reaction. Anything that spikes really high or really low, far from the line, are things that your body has an inflammatory response to, and those are things that you would need to be desensitized with.
So you're right now introducing the frequency of, say, milk via the cuff, and this is measuring the changes that are happening.
Yes. And from here, it'll rank everything that you're considered allergic to or anything that's inflammatory. It's going to rank those and rank them from anywhere between 0 to 1,000. 0 are things that your body has no response to. Your body can handle that. Anything up in the 900s or in the thousands, your body is having a hard time, and it causes allergens or allergic response, and it's an allergen to you. So at this point, we're going to choose anything that's considered a high priority or a high allergen in your body. We'll select that and put that in our treatment folder. From here, when we choose these, the machine is actually going to, at this point, it's going to rescan, and it's actually going to come up with balancing frequencies for those items based on your skin response. So every treatment is tailored for that person, for that allergen.
Okay.
So unlike allergy shots with light treats, like if you're allergic to milk, they would actually put milk in a little serum and inject it in your body till your body eventually comes up with a tolerance to milk.
Like when people have allergy shots.
Correct, when they have allergy shots. This is doing something similar, but what's nice is this is actually tailored for your body. So it's not just a generic milk, but based on your reaction, it's giving you back, let's say milk, but it's going to come up with a milk balancing frequency based on your reaction.
And a lot of times people that are having shots, that might take 3 to 5 years of treatment once a month or more, whereas this is at the most 13 to 15 treatments, right?
Yes, that's correct. Most people need a few treatments, but some people might need a little bit less depending on their body's response and how fast they can heal. And so from here, we're going to demonstrate a short therapy session. And so basically, you're going to hold the electrode in one hand and the cuff is on the other hand, and this lets the balancing frequencies go through your body.
Okay.
From here, balancing frequencies will also come out through the laser, through fiber optics. So you can see it's just like a light. So we have 3 different frequencies, we have 3 different wavelengths of light, but through the light, your healing frequencies are coming out through the light. And from here, during our treatment, we're just going to laser certain acupuncture points on the body, especially the ear. So we would kind of what we call paint the ear. We would laser the ear in this manner because we're stimulating all the points on the ear that correspond to parts of your body.
So this is the actual treatment right now to desensitize me to what the assessment showed I'm sensitive to.
Yes.
Right.
And this is as painless as it is. So we're just going to paint the laser on your ears. We'll paint the laser on both ears as well as other acupuncture points in the body to help the body balance. And that completes the treatment.
Okay, well, great. Thank you. And if you want more information about the LZR7, actually this technology we've been using now for probably about 6 or 7 years, and it started out named LZR7, and it's been renamed to ASA Balance. So you can Google either one of those and get more information, or you can go to our website, carneswellness.com, and just click on a patient tab, and it'll come down to testimonies. If you click on that, you'll see a lot of LZR7 allergy testimonies. So those are very helpful for people to learn more about it, and so we thank you for sharing this, and we hope this is helpful.